After the patient's unfortunate demise, it was determined that the day nurse did understand the intended dosing but made an error when entering the dose into the IV pump. The nursing team, as well as the doctor and the hospital, indicated that the root cause analysis revealed that documentation and communication of the dosing of medication varied from the standard system, and it had changed throughout the time of it looks like 3 days that the patient was admitted. It was noted that the excessive medication dose was preventable and was a result of a failure of systems within the hospital's control. So therefore, the hospital did admit that they were at fault in this case, that the patient suffered an excessive overdose of loperamide, directly leading to hemorrhage and death. Some ethical considerations, what the ethical duty of the nurse when administering IVs, including, patient safety. The nurse has to verify the patient's allergies and any contraindications of the fluids that are administered, also verifying patient's weight to ensure the amount and rate appropriate for the patient. The nurse must receive the patient's consent and understanding of the IV solutions that are receiving if they are competent. The device also has to be in working order, plugged in with backup batteries, and the bag and tubes need to be clean and also in good condition. Also, labs need to be taken at the appropriate time, and if that lab, comes back as compromised, it does need to be retaken. The IV access site on the patient also needs to be clean and in good condition, and the patient's vitals need to be constantly monitored throughout the time that they are receiving this medication. Some recommendations I would give regarding this case is, that can prevent future cases like this in the future, would be, they can be prevented by checking the 6 rights, verifying you have the proper patient labs, weight, and any other pertinent information. You have correctly calculated the drip rate and the amount based on the order, and then double checking this information with another nurse, the charged nurse, and the doctor if any confusion occurs. Properly documenting the doses given and times along with the labs is essential as well. Retaking the labs immediately if the lab specimen comes back as compromised is essential as well. And the most important thing for me is always, in this case, is always ask questions when you are having doubts and confusion while administering any care to a patient to avoid any medical errors. My name's Audrey Roller, and thanks again.